Because of this year's sharp increase in measles cases, we want to share some information with you to help you better understand the disease, why it's a concern, how it's transmitted, how to prevent getting it, and what we're doing in Haywood County about it. Measles was declared eliminated in the United States in 2000, but that didn't mean it was eradicated. Globally, measles continues to be a scourge, and as we all know, people travel around the world every day. Just last year, France had 2,913 cases of measles. Italy had 2,686 cases, and Britain had 953. So far in 2019, we had 704 cases in the United States, including 4 in East Tennessee. Measles is an extremely contagious virus, and it also is quite harmful. Globally, measles killed 110,000 people in 2017, mostly children less than 5 years of age. 1 in 10 children with measles gets an ear infection, which can lead to deafness. 1 in 20 children with measles develops pneumonia. 1 in 1,000 develop encephalitis. 1 or 2 in 1,000 children who contract measles will die. Measles is transmitted by droplets from an infected person's nose or mouth by infected people coughing or sneezing. The virus can live on surfaces for several hours. Infected people can transmit the measles virus starting 4 days before they develop a rash. You can see from these reasons why measles is so contagious. After the rash appears, the person is contagious for 4 additional days. According to the CDC, you can catch measles just by being in a room where a person with measles has been, up to 2 hours after that person is gone. Symptoms of measles. An infected person shows no symptoms up to 2 weeks after being infected. Then, symptoms typical of a cold or virus: moderate fever, cough, sore throat, runny nose, red and swollen eyes. 2 or 3 days of that, and the fever spikes to 104 or 105, and the telltale red dots appear on the skin, first on the face, then spreading down the body. There is no cure for measles. Some people who can't get immunized, such as pregnant women, babies, and people with weak immune systems, can receive an injection of antibodies, immune serum globulin, within 6 days of exposure. The measles, mumps, and rubella, or MMR vaccine, is extremely safe and effective. MMR causes no side effects in most children. 1 dose of the vaccine is about 93% effective. 2 doses boost that number to 97%. According to the CDC, almost everyone who has not had the MMR shot will get measles if they're exposed to the measles virus. And always remember, some people can't be vaccinated for medical reasons, such as infants, pregnant women, and people who are immune compromised. Herd immunity is a term sometimes misused to indicate we are all protected against a disease like measles. Actually, herd immunity varies by disease. A highly contagious disease like measles requires a very high percentage of people to be vaccinated. Because measles is so contagious, between 93 and 95% of people in a community need to be vaccinated. As some people have chosen not to get vaccinated against measles, it has created the opportunity for the virus to spread. That's what we are seeing in 2019. The Haywood County Health Department has been preparing for measles on an ongoing basis. We completed a measles tabletop exercise in March with our epidemiology team. We featured measles information in our quarterly epigram sent out to medical providers in March. We're in close contact with our school system. We've been answering questions from the public daily. We do have an adequate supply of the MMR vaccine. If you have questions about measles or the MMR vaccine, please give us a call or send us an email. For information or questions about immunizations, you may call Cheryl Lindsay at 828-356-2247 or email her at cheryl.lindsay@haywoodcountync.gov. For questions or information about communicable diseases including measles, You may contact Barbara Dennis at 828-356-2235 or email at barbara.dennis@haywoodcountync.gov. For all other questions or information, you may contact our Public Health Director, Patrick Johnson, at 828-356-2244 or email patrick.johnson@haywoodcountync.gov.